You're on the Nation at 5. I'm Anand Narasimhan. Ladies and gentlemen, let's take a look at some of the numbers that we need to be very, very conscious about. It's an unprecedented high in the number of active cases or the daily caseload, which is surging past the 3.5 lakh mark. But what is also very, very heartening to see is the pace of the recoveries in our country. Let's have a look at the numbers. 2.2 lakh recoveries in the last 24 hours. So we do have it in us to beat this virus. We can recover, we can beat it hollow if we just set our hearts to it. That's what we can see. A big dip in the total number of cases in Mumbai, where perhaps the Janta curfew is coming into play, but that's a big slide from about 11,000 cases early April to just 3,792 cases in the last 24 hours as far as Mumbai is concerned. Let's take heart, let's follow COVID appropriate behavior, and let's try and fight this out. 14.19 crore plus is the total vaccine doses that have been administered. It's the fastest worldwide, and this will only pick up pace. All issues as far as supply lines, whether or not vaccines will be available, well, there is a lot of work that is happening at the back end, and perhaps we will be ready for a never before like vaccine drive starting the 1st of May. Over 10% population have actually received at least one vaccine dose, which is very, very encouraging. And soon, the second round of vaccinations, that rate will also kick in. Zero COVID deaths in 5 states and union territories in the last 24 hours. And of course, Mission Vaccine 3.0 vaccinations for 18 plus from the 1st of May. This is going to be perhaps one that is going to give us the biggest weapon to fight this virus, and most importantly, reduce the mortality. The number of people who will succumb to this illness will come down drastically the moment we start getting ourselves inoculated. The national average is only 36% for 60 plus. That needs to be worked upon. That needs to be worked upon, because that age group, along with those with comorbidities, are the most vulnerable to perish or succumb to this virus, ladies and gentlemen. Let's also look at some of the other reasons why we need to believe in ourselves as a people, as a collective, as a nation. In Mumbai, a group of youngsters have stepped up and are doing their bit in fighting COVID. They have been providing water to hospitals and vaccination centers across the country for free for more than a year now. Now, till date, the volunteers have provided over 1 lakh liters of water across 14 locations. Salute to them. Most basic of the requirements, but they are keeping it there in handy for people at hospitals and all these COVID centers, especially for the frontline workers. Well done to these volunteers. In Gujarat's Vadodara, the Jewelers Association is also doing their bit to fight against COVID. They have imposed a self-lockdown in the city, which started on Sunday and will be in place till the 2nd of May. More than 500 shops will be shut during this period as they look to break the chain of COVID-19. To this Jewelers Association, well done. Use this time. I know it's going to hurt your livelihood, but use this time to also ensure that your shops are COVID appropriate, so that when you up the shutters once again and people walk in, the crowds are controlled, there is social distancing, and again, COVID doesn't get another chance. Meanwhile, in Odisha's Bhubaneswar, Sikh organizations are doing their bit to fight in their fight against COVID at a time when oxygen demand is very, very high. Sikh aid groups in the country are ensuring oxygen cylinders are provided to COVID patients who are in home isolation. The oxygen langar has been started by some of the gurdwaras in other parts of the country, and all of this is going to help. And of course, there are others who are plying their wares in India and also helping in the cause. Sportspersons like cricketer Pat Cummins, amid this entire raging debate and criticism over the BCCI confirming that IPL tournament will continue, Pat Cummins coming out and saying that if we are going to provide relief, certain amount of entertainment and perhaps joy to the households as they watch us, here is my contribution, as he makes a contribution to the PM Cares Fund. He's donated $50,000 to the PM Cares Fund for the purchase of oxygen supplies and also building up of oxygen plants across the country. Pat Cummins, who's presently in India for the 14th season of the Indian Premier League, has also urged fellow IPL cricketers to come forward and help with donations. Well done. This Jazba, a big salute to that. Joining us now, Dr. Neil Pinto, founder of Pint Network, and of course, Rushil Seth. These two are plasma donors, and they're trying to help others who have recovered also to come together and donate plasma. Let me ask Rushil. Rushil, congratulations. I believe you've donated your plasma. Are you encouraging others too? Because every day I'm also inundated with requests for plasma. I'm here in Delhi and the National Capital Region. Do you have a group? Where are you based, and how are you helping people?
Yeah, so thank you so much. And I think this is a great initiative which is there, which was taken by Pint Network. And so I'm a chartered accountant by profession. Being a non-medical student, I've always had that feeling that during lockdown, there's nothing which we could do to actually go out and help those millions of people who are there. So as a volunteer of Srimad Rajchandra Love and Care, which is an excellent organization which is working relentlessly on helping migrant workers and doctors across the world deal with COVID, I saw my friends actually go on the field and help someone. So I felt when I got this message to kind of join Pint Network, I felt this is my opportunity to make my difference, which I can do. So I think this is something which really, really, really touches everyone's heart. And I think anyone who can go out there and donate plasma definitely should do so.
True, but how are you people helping? Let me ask Mr. Pinto here, the Pint Network, how are you working, operating, Dr. Neil? And also, where all are you operating?
Those are two very good questions. So we actually primarily connect patients to donors. So when we get a patient registering, we simply find a match with the donor who's eligible. And then we send them a text message and email, as well as we have a group of volunteers and doctors to actually call the patients and donors and really connect them and help them through the process and take it forward. And we have wonderful donors like Rushil who came forward. I remember when he donated, there was a flood, and he, despite the flood, traveled all the way from town to Bandra to donate. And regarding the cities where we operate, we primarily operate in the four major cities where there are the maximum cases, which is Mumbai, Delhi, Hyderabad, and Bangalore. And we also operate in other cities like Ahmedabad, Kolkata, Visakhapatnam. We have smaller cities, but the main requests we get are in the major cities of India.
True, but what would you tell people? What is happening is, despite a lot of people recovering from COVID-19, a lot of them having also antibodies, a lot of people are not stepping up. That's something that we see, Dr. Neil. What would you like to tell them? How is it that they can help? Because when people reach out and say, help me, and we push them towards numbers, they say we don't have donors. That is something which people are not stepping up and doing. So can you explain the process, how easy, difficult it is, and who all can come out and donate?
Yeah, so the process is actually very easy. You just have to go to a hospital or blood bank. They do three tests primarily. One is an antibody test, one is a complete blood count, and one is a test to rule out any infection. And once they find you're eligible, then they carry out the plasma collection process, which takes only about 30 to 40 minutes. So the entire process, all in all, takes only about 2 hours of your time. And it goes a long way because a single plasma donation can save two lives, not only one life. And regarding the eligibility criteria, so you actually have to be 28 days from your COVID negative report or your last day of symptoms. You have to be between the age of 18 to 55 years. Unfortunately, for women who have been pregnant in their lifetime who suffer from low hemoglobin levels or anemia, they are generally not allowed to donate. So that is also one of the criteria. And they also would have to have their reports, which is their COVID positive report, as well as their COVID negative report. But I would say, all in all, the process is very short. It's a small difference that could have a huge impact, and it would definitely support our frontliners who've been working tirelessly on the field.
True, but there seems to be a certain amount of doubt. How would you tide over this doubt? How can people come out and join and create a bigger network, Rushil?
Yeah. So I think what Dr. Neil Pinto rightly mentioned, there are a lot of myths around this entire plasma donation. So like a lot of people think that, okay, I have to go only to a COVID positive hospital to donate, which is not the case. As he mentioned that we could go to a blood bank, which is non-COVID positive. Secondly, people feel that, okay, I may get weak. Like, am I going to be strong enough after like just recovering, going and donating plasma? So that is not the case either. So what they do is they kind of transfuse the blood back. So it's just a matter of those 2 hours which you are spending, and you are donating plasma and saving lives, and there's nothing which you're actually losing in that case. And I think third biggest myth which I understood was that people feel they can go only once, and once they're done, that's it. But what I believe is, as long as your antibody count is there with like a time gap, you can go again. So a lot of these facts are not very clear, and because of this lack of clarity, people are not going out and donating the way they can.
True, but Dr. Neil, let me ask you this. I myself have recovered from COVID sometime in November. I got my antibody test done, on the 1st of April. And when I approached somebody to say, can I donate my plasma? They said, you should have recovered in the last 40 days. I said, I've got antibody count is 2.13, 1.4, anything greater than 1.4, they say you are non-reactive. That's what the report says. So advice, tell me, can I donate my plasma or do you have to be in that window of 40 days?
The short answer to your question is yes, you can donate plasma, but unfortunately, across the hospitals across India, every hospital has their own criteria. So some hospitals prefer to keep a window of 2 months, sometimes 40 days from recovery. And that is for the primary reason, because the primary reason that they have to do the antibody tests. And a lot of the times when 2 months have passed, the antibodies have shown to decline. So sometimes to save on their own resources and time, they tend to prefer earlier recovered patients as compared to later recovered. However, there have been a lot of blood banks who accept people not only 3 months recovered, but also 6 months recovered, because the real reason for donation is antibodies. And if you do have antibodies, then technically you are allowed to donate.
So I'm still allowed to donate, because when I reached out, they said, sir, you should have recovered in the last 2 months, because you may still carry antibodies, but we don't know if we can use your plasma or put it to good use. But now that you're telling me, I'm going to do that on priority. I'm going to approach another hospital and say if they will take my plasma, and I will join the cause. However we can help, we need to help. Rushil and Dr. Neil, thank you very, very much. Great work done, and let's hope that more people step up and donate their plasma so that we can save lives and do our bit to help those in need. Thank you very, very much. Moving on for the moment, news is coming through. As India battles the deadly second wave of COVID-19, Niti Aayog member Dr. V.K. Paul has said that we should mask up even at home. Listen in.
ये भी याद रहे कि अगर घर में एक पॉजिटिव व्यक्ति है तो जैसे अभी दिखाया कि उसको बहुत ज़रूरी है कि वो मास्क पहने, क्योंकि वो फेंक रहा है वायरस बाकियों को। और बल्कि अब मैं कहना चाहूँगा कि सीधा टाइम आ गया कि घर में हम वैसे ही अब मास्क पहनना शुरू करें। हम बाहर की बात करते थे, लेकिन संक्रमण जैसे है ज़्यादा है तो घर में भी बाई चांस किसी को आ गया है तो जहाँ तक हो गए घर में भी जब हम किसी के साथ बैठे हैं तो मास्क लगाएं तो फ़ायदा है। लेकिन डेफिनेटली अगर कोई पॉजिटिव है उसको भी मास्क लगाना है, बाकियों को भी लगाना है, उसको दूसरे कमरों में रखना है।
Well, we'll try and go across to Runjun Sharma for more on this, but did Dr. V.K. Paul mean that if there is somebody in the house who is COVID positive, then everybody has to mask up? Or is he now suggesting that even as a precautionary basis, you even in your house just mask up? Runjun Sharma, yes, Runjun.
Anand, what Dr. V.K. Paul is trying to say is that there is no harm if you wear a mask at home, given the fact that we are amidst a deadly second wave. So he's saying that, in fact, the time has come that people can now wear masks at home. And of course, especially if a person is positive, they need to mask up. The family members need to mask up, and any which way, even if you're not positive, there is no harm in wearing a mask, given the fact if, say, somebody is positive and asymptomatic, the other people will not catch the infection. Apart from that, Dr. V.K. Paul also suggested that this is not the time where you invite people over. So, of course, absolute stress on isolation. And, really, the Dr. V.K. Paul saying that extremely important to wear a mask. Of course, outside, now it's you wear a double mask outside, but more so if you're inside, it would be beneficial if you wear a mask.
So is it also an indication, Runjun, that perhaps the mask is, now the virus is airborne?
Dr. V.K. Paul did not throw light on the virus being airborne, but we did see a study published in the British journal, Lancet Journal, just a few weeks ago, saying that there is enough evidence that COVID-19 virus is airborne. So, Anand, given that and given the fact that we are amidst a second wave, which is extremely deadly, and also the fact that the healthcare infrastructure is extremely overburdened, it's extremely overwhelmed with just the sheer number of people who are now reaching out to get ICU beds and hospital beds and ventilators in hospitals. It is, as a precautionary measure, it is beneficial if people inside homes also start wearing a mask.
Well, thank you for your inputs, Runjun. We are averaging close to 3.5 lakh cases in 24 hours, and we are not yet near the peak. And as we as a nation battle this entire COVID surge in the second wave, the global community is coming together to help us in battle this second wave storm. The US has to deploy resources and supplies to Serum Institute of India to boost vaccine production. The US is also supplying rapid diagnostic test kits, ventilators and PPE kits. 318 oxygen concentrators from the US have also reached India earlier this afternoon. Meanwhile, the European Union too has extended support to India and has mobilized aid to facilitate India in curbing the contagion. The UK too has actually sent oxygen concentrators and ventilators as India's health infrastructure is feeling the pressure of a growing number of cases on a day-to-day basis.
मुश्किल के इस वक्त में यूके भारत के साथ हैं। प्रधानमंत्री बोरिस जॉनसन ने आज ऑक्सीजन कंसंट्रेटर्स और वेंटिलेटर्स भारत को भेजने का फैसला किया है। कोरोना को हराने के इस जंग में यूके भारत के साथ कंधे से कंधा मिलकर आगे बढ़ रहा है।
The countries in the world are coming forward to help India to fight against COVID-19. Especially America, UK and France, they are ready to supply the necessary equipment and medicine to the country. It is responsibility of the center that they must appoint the people, make a smooth delivery of the goods which will be delivered by these countries.
Maha Siddiqui now joins us. Maha, it is very encouraging to see nations coming forward. Singapore, Australia were some of the first nations, first respondent nations. We are collaborating with Russia. America took its own time. So did the UK. Is this humanitarian or is there a cost in it for us? Is it transactional?
For the moment, of course, some countries are helping out. It's more of a humanitarian aid. The oxygen concentrators, the ventilators that are coming. Some countries, for instance, America, now that they know that they have enough vaccines for their own population, they can allow for the export of the raw materials. Now, they are saying that they have identified the exact raw materials that are required by the Serum Institute for further manufacturing of Covishield, and those will be allowed to go. And they will be, in fact, immediately dispatched to India. Now, these were to be exported to India by the various companies. So I believe that still remains. These will be exported. This will have a cost. However, oxygen concentrators, ventilators that some of the countries are sending could be on a goodwill basis. From what we know as far as Germany is concerned, which has given 23 mobile oxygen concentrators, that again is being imported by India. So yes, some of it is goodwill, some of it is also transactional in nature. But at the moment, when countries are trying to hoard stuff for, or rather life-saving equipment for themselves on priority, even this, extension of a helping hand comes as part of goodwill, even if it involves any cost currently, because India is in dire need of oxygen concentrators, of containers, cryogenic containers. All this is the requirement for transporting oxygen safely, medical oxygen, to hospitals, especially those that have been red flagging a shortfall.
Well, but Maha, the idea of being transactional is not whether India has to pay for these concentrators, but when you have two NSAs striking a deal, then is there a strategic cost that comes into play? And are there conditions on this humanitarian, so-called humanitarian help that America is extending? Because it has taken its time. They were already sitting on 5.2 times the stockpile that is required for vaccinating their population. So just like Canada is sitting over 9 times the actual requirement for vaccinating its own eligible population. So that's what, is there a larger cost which India has to pay, which perhaps will force a rethink on how India will engage with some of the nations going forward?
Well, some of the most of the nations have come to a realization that everyone is safe, that no one is safe till everyone is safe. And why I'm saying that is because we are seeing the virus mutate, and the mutation sometimes can impact a person who's already been infected in the first go. So that realization has dawned upon many of the countries that even if they vaccinate their populations on priority, if this virus keeps raging across the globe in some of the other countries, for instance, right now in India, or the South African variant that we were talking about earlier, which was far more infectious, then it defeats the purpose to some extent of vaccinating large populations against one particular kind of mutation or variant of the virus. It is imperative at this juncture that the virus is stopped in its tracks, and for that, collaboration and cooperation is necessary. That is what experts have been pointing out, and I think that realization is something that is now dawned upon some of the countries, because you can't suspend flights forever. There will be movement of people, there will be movement of equipment, there will be economic activity, and for that, when the world is a global village, certainly it is imperative that all countries are made safe. And I think that is why now we are talking about these supplies coming. Yes, of course, it's taken 1 month for America to look into India's request, which India has been asking for, saying that our vaccine production is going to be hampered because of these raw materials not arriving. Now that America is well placed as far as their own population is concerned, they are willing to send it out.
Well, thank you for your inputs, Maha. As early as the 6th of April, Serum Institute of India CEO Adar Poonawalla had spoken exclusively to Network 18 during the launch of around the launch of our campaign Sanjeevani, a Shot of Life, and he had said that lifting the US ban is critical to boost the vaccine drive.
Now the new challenge is, the really big one, is getting enough raw materials which are being hoarded globally. And whether it's for Novavax, the Covovax product, or Covishield, we don't want to be in a situation that we ramp up in 2 months, as we mentioned, and then we're running short of raw materials. That's why I've flagged it to the US and everyone else that Covovax is going to be produced at 50% capacity as opposed to 100% from the month of April, May, in terms of stockpiling, if we don't immediately see the ban of raw materials from the US being lifted.
Now, iconic buildings in the UAE were lit up with the tricolour on Sunday night to show solidarity with India amid the surge in COVID-19 cases. The world's tallest building, the Burj Khalifa in Dubai, and the ADNOC headquarters in Abu Dhabi were lit with the Indian flag, as well as a message, "Stay strong, India." Fantastic gesture there by the UAE. Meanwhile, Vedika, a 9-month-old baby, has been diagnosed with spinal muscular atrophy type 1, a serious genetic disorder that usually kills babies before they turn 2. It can only be treated with a 16 crore rupee injection that should ideally be given before her first birthday. The family is currently fundraising through Milap and have already raised 4 crore rupees. Your small contribution can help Vedika get the cure at the right time. You can donate by visiting milap.org/Vedika.